Hello, everybody. We're going to go ahead and get started. My name is Kayla Peters. I am with the Kensington Falls Church. So good evening, and thank you for joining us for our presentation, Does Your Loved One Have the Medicare Coverage They Need for 2024, presented by the Kensington Falls Church and Medicare Portal. Just one housekeeping note, please utilize the chat feature or the Q&A feature to ask any questions. We'll answer questions towards the end of the presentation, and they are highly encouraged. Kensington Senior Living has 7 unique communities, 4 located in Virginia, Maryland, and New York, and 3 sister communities located in California. Kensington is truly privileged to support individuals from coast to coast. At this time, I'd like to introduce our presenter, Kevin Chaikin, licensed insurance specialist with Medicare Portal. After having a front row seat to his own father's frustration with Medicare, he committed his insurance practice to prevent as many other people as possible from going through the same painful process. Kevin was born and raised in Fairfax County, Virginia, which is where he still resides with his wife, 2 sons, daughter, and 2 dogs. It's a full house, and he wouldn't have it any other way. It's family first for Kevin, always. Some of his other interests include business and the challenge of growing his own, sports, exercise, travel, especially to the beach, music, listening to books, podcasts, self-improvement, and in a post-pandemic world, a renewed commitment to seeking new experiences. So without further ado, I give you Kevin Chaikin.
Thank you very much, Kayla. That was great. Appreciate that. Well, thank you all for being here. Thanks for having me. Always a pleasure to partner with Kayla and the Kensington and some of the several other locations, actually. So just a great place. And I've had a chance to actually visit multiple locations, primarily here in the DC metro area. But today we're going to talk about Medicare and making sure you know or your loved ones know what they need to know about Medicare, especially right now during the annual enrollment period. So I will promise you, I know it's late in the day, probably not thrilled about listening to me drone on about Medicare for too long. So we'll move quickly, but not too fast. Make sure we cover things and don't skip over anything. We'll have plenty of time for questions, and we'll get you out of here at a reasonable time. But without further ado, let's go ahead and move right along here. I guess that's up to me to figure out. Okay, here we go. Excuse me. So this is just, I want to have a little fun here starting out since we're talking about such an exciting topic. What are you normally told during the Medicare annual enrollment period? These are the things that we hear. So number one, now is the time to make a change and you must do it. Number 2, you qualify for plans that will cost you nothing and pay you back your Part B premium. And number 3, you can get thousands of dollars worth of free medical supplies and groceries and all sorts of benefits. If we had a room here, I'd certainly ask, raise your hand if you've heard that. Sure, if you've ever turned on the TV, you have, because you hear it from our Medicare annual enrollment mascots. I'm sure you all recognize these gentlemen and others who are now really just known these days for promoting Medicare plans. And unfortunately, it seems like they are promoting them in what I would call a less than ethical way. Maybe that's a nice way to put it. There are 2 things that we would say every senior should know about annual enrollment. Number 1 is you don't have to make a plan change during annual enrollment. It doesn't mean that you shouldn't be actively engaged. And so I say you should do something. That just means to be aware and to make sure that you or your family member is looking at what's changing with your plan and what's available. It does not mean you have to make a change. And number 2, it's an old adage. It's true in a lot of ways, but definitely with Medicare annual enrollment. If it sounds too good to be true, then it probably is. And that is us at Medicare Portal who are telling you that. Myself are there, of course, on the left as your Medicare insurance partners. We want to give it to you, really just give you the honest truth. I would love to work with as many people as possible, but also, not everyone's situation lines up with what we can offer, nor does yours, and mean that you don't need to change all the time. So no need to just keep moving around from plan to plan if that's not what's best for you. So just real quick, who is Medicare Portal? And I think we have a slide later on. We actually technically are now the MP group, just for compliance purposes. There were some changes in CMS rules this year, but we'll get to that later. But we are an independent Medicare insurance agency based out of the Tysons Corner, Virginia area. We do service the good part of the country, but we provide no cost education, enrollment, and lifetime support to Medicare beneficiaries. I just want to cover the no cost thing there for you. So there's never a fee that you or anyone would pay to us. You would never pay more for your insurance. We are insurance agents at the end of the day. So we are paid on the insurance that we help place. If we can't help you, it's okay. We can't get paid. That's okay. We want to make sure we're putting the right goodwill out there, and obviously we can help others. But that's how we're paid. We're paid by the insurance companies that you do business with for supplemental and other types of Medicare insurance. So again, never a cost to you to have this extra resource. This is our current footprint. Again, we are obviously focused on a hyper local scenario here with the Kensington, but obviously there are other locations across the country. You may have friends and family. We are ever growing, expanding our footprint here in the States. Kayla gave a great introduction, so I'm just going to pretty much skip right over this. But this is basically what she was talking about, and going back to my dad being the one that fumbled through this, that kind of got me into that, and that's where you see me start in 2019. So, what will we cover today? These are the topics here. We're going to get on a kind of get level set together on what are the parts of Medicare. So we've all got a good, one-on-one level understanding before we get going into annual enrollment. And the rest, this is really about what is this enrollment period we're talking about, who's eligible, what can change, how can you find changes, what changes can you make, and then some additional changes for next year and beyond, and then a little bit more about how we can help with this particular part of Medicare. So Medicare has these four primary parts A, B, C, and D. And this is where the alphabet soup starts, and you start to, really get confused because we've got A, B, C, and D. We've got Medigap. We've got Medigap plans, A, B, C, and D, G, F, all these different letters. They repeat sometimes. Really, I think a lot of us could have come up with a better way to identify some of this stuff, but it is what it is. Like to have a good laugh about it from time to time, but it's confusing, no doubt. So let's start with Medicare Part A, do an overview here. This is your hospital coverage. On your Medicare card, it says Part A hospital. Think of this as your inpatient coverage, not only hospital, but rehab, skilled nursing, home health, and hospice. This is going to be $0 a month for most everybody. It's basically you've paid your taxes all your life, or you have a spouse perhaps that paid taxes that you qualify off of, just like Social Security. If you qualify for Social Security, you qualify for that premium free Part A. It's the 40 quarters you need for Social Security benefits. You can purchase it if you are in that position. Again, that is rare. It's also extremely cost prohibitive. Very unlikely, though, that you do. So we'll continue going here. Medicare Part B is your medical coverage. So again, right there on the Medicare card, Part B medical is what it says, along with your start date. This is more outpatient. So your doctor's visits, all your healthcare providers, outpatient care like a physical therapy, surgery, MRI, CAT scan, X-ray, emergency room, chemotherapy, radiation, preventative services, all under Part B. By the way, parts A and B are the only parts issued by the government. Okay. That's who administers it. That's who pays claims, is the government on A and B. Everything else you hear about with Medicare, C, D, Medigap, beyond, that we'll talk about after this, is going to come from an insurance company. So what does Part B cost? The premium does vary based on income, but most people are going to pay the base premium for the year, which this year it's $164.90. That says plus IRMA. That's the income related monthly adjustment amount. You could be impacted by that because of a higher income. Usually it's before retirement that you get hit with that on, and then so you get to appeal it, but it could happen in retirement. But essentially you could pay more. On the other hand, if you qualify for certain low income programs like Medicaid, you might pay less or nothing on your Part B premium. But again, most people will pay that base rate. By the way, and we'll show this on Part D as well, but if you don't navigate this properly, Part B can come with not only the income adjustment, but late enrollment penalties if you don't have proper coverage to replace it. Part C, this is Medicare Advantage. Part C, I like to think of as standing for combined coverage. It puts it all, combines it all into one plan under one roof. So basically what happens is that red, white, and blue Medicare card with A and B, you're going to tuck that. If you go to Part C, you're going to tuck that in your wallet or your safe at home. And Part C is now taking over everything. So the insurance company is who provides it. The government pays the insurance company for your Medicare Advantage plan. That's why a lot of those are very little to no premium. And they offer all these benefits. So they're going to cover your inpatient, cover your outpatient, hospital medical. Typically, they'll provide prescription drug coverage along with other benefits that Medicare may not provide, for example, dental, vision, and hearing, amongst others. These are managed care, network-based plans, HMOs and PPOs primarily. You have a few other plan designs there. They are definitely more similar to commercial insurance, something we're all used to when we're buying our own marketplace insurance or going and getting an employer plan through our employer or our spouse's employer or family's employer. Again, monthly premiums will vary. These plans are really by the zip code or the county typically. So what's in Fairfax County is not what's in Montgomery County. Obviously, different state as well, but that's how close you can be and have differences in your plan. And so everything varies, plan premiums as well as all the different benefits. But again, the plan premiums on these are very, very minimal, and then they are oftentimes zero. So the claim that there's $0 plans out there, that is not false. It's just that the rest of the truth is not told in these commercials. Part D, this is your prescription coverage for self-administered outpatient prescriptions. You would get a Part D plan separately if you went with original Medicare A and B in a Medigap or Medicare supplement plan. If you got, again, going back to Part C, it would be typically in the plan, combined into that plan. So Part D, again, also from the insurance companies, these will have certain structures that Medicare requires in terms of thresholds to go to different stages of coverage, requirements to have a certain number of drugs in every therapeutic category on the formulary, maximum deductible, things like that. But then there are also a lot of variables. The premiums vary. They're all over the place. The formularies are different. So what drugs are on them and what tier they're on. The tiers affect the pricing. So the pricing is different. So they are definitely a mixed bag, and what's good for one is not necessarily good for the other, and that includes in the same household. So don't make that decision based on what somebody else told you. As I mentioned earlier, there is a penalty for not enrolling on time, just like Part B. There's also an IRMA adjustment. So again, if you're in that higher income bracket and you're impacted on Part B, you'll also be impacted on Part D. Now, Medigap, this is an extra component of Medicare, not technically one of those 4 parts that we show, but this is another insurance policy. This is going to be added if you have A and B and you're not doing Medicare Advantage, right? The Medigap policy is a secondary policy. You do need A and B to have it. You need A and B, quite frankly, to have Medigap or Medicare Advantage. But you must have Medigap, or you must have A and B to have Medigap. It's basically going to cover a lot of what the Medicare does not. So if you're on original Medicare A and B by itself, you have no limit to your exposure. There's no out-of-pocket maximum. So $1,600 deductible this year, every hospitalization benefit period. You have very high $400 to $800 copays in the hospital for long-term copays. It's per day. Skilled nursing, $200 per day after the first 20 days. And the big one, when we use Part B more often, is the 20% coinsurance with no ceiling. So that's what Medigap is there to do. It's there to provide you financial, or reduce your financial risk, provide you some peace of mind. Medicare does allow you to go to any doctor in the country who takes Medicare, and the supplement's the same way. There are no networks, no referrals. And so if the doctor facility takes Medicare, they will take your Medicare supplement, no matter what company it is or what plan it is. They are standardized. And again, Medicare is your primary payer, and that's all the provider cares about. So you don't tell them that you have ABC insurance company. You tell them you have original Medicare, and that will determine whether they can see you. Premiums are all over the place. I can't give you any dollar amounts, even though we might even all be in the same geography here in Fairfax County. Age and gender play a huge role in that. So that's gonna impact it. Tobacco use and household size as well. And of course, the actual plan. So assume typically on Medigap, you are going to pay more up front and maybe less on the back end versus Advantage, where you'll typically pay less up front and more exposure on the back end, depending on your utilization. This is just a chart of the Medigap plans that are available. We don't need to dive into each one. C and F are no longer available to new enrollees. That is something to know. So you may hear, oh, my neighbor, my friend has Plan F. Can I get that? Well, if you're just turning 65 now, No, you cannot. That's basically for people who were born before 1955. And that's okay, though. Don't fret. There are great other plans available, like G is the most comprehensive now. But essentially, you can see where we talk about reduced exposure. Plan G covers 100% of your Part A coinsurance and hospital costs, 100% of your Part B coinsurance. That's 20% of your bills with no limit. That's covered 100%. All right, all the way down. Right, there's a few gaps in here with each plan, but these are the options that are on the market today. By the way, a bunch of those do also provide some foreign travel emergency coverage. For those of you that may travel internationally, you do get some travel coverage there as well. Here's a case study. Just want to share this with you, talking about Plan F and supplements, right? So what happens is a lot of people that were on Medicare, call it before 2020, were told, get Plan F, it's the Cadillac. And it's great. You pay literally zero out of your pocket. See Plan F here? Everything is covered. Ignore the foreign travel. None of them cover 100%, but everything domestically covered by Medicare. You have zero bills. Okay, but what happens is nobody new's getting into that plan. So population's getting older, presumably more claims are being filed, costing the insurance company more, premiums are due to rise more and more. So Carol, in our example here, is 70-year-old female on Plan F. Let's say she's been there for 3, 4, 5 years. She's paying $173 a month on this plan. After reviewing that her coverage options, it's determined that she can move to Plan G and pay $133 a month. So she's saving $40 a month. But you might say, well, yeah, she's saving $40 a month, but what is she losing? And that's an important question. The reality is the only difference on Plan G and F is that Part B deductible is not covered on Plan G. That's $226 for the year this year, right? So it's a very small amount. So when you look at this, the math on this particular scenario, and this is just for illustrative purposes, savings could be nothing, less, significantly more. It just depends on your situation. But this individual would save $254 in the first year on this plan. So what is annual enrollment? Annual enrollment is a set time of year where enrollees can evaluate and change their Medicare coverage. Pretty simple. And I would say we're underway. It's not officially open. October 15th is the first day, but it feels like we've been doing this for a month now. Things just get crazy busy this time of year because people are doing the right thing. You're actively engaged. And again, don't panic that you have to change anything, but you should look into it. So October 15th through December 7th, changes can be made. Change will go into effect January 1st, 2024. Now, who is eligible? This is for current beneficiaries only, okay? If you are still working and only on Part A, has nothing to do with you. If you are turning 65, even if that's in the fall or January of next year, this has nothing to do with you yet. Of course, it will at some point. But again, this is for current beneficiaries. So if you're looking at retiring end of the year, you're turning 65 soon, you do need to be doing something. You should be talking to somebody and getting your plans in place, but it has nothing to do with this enrollment period. So what can change in these benefits on an annual basis? Well, look, Medicare Part A and B are going to change every year anyway, whether it's, has nothing to do with AEP. It's, premiums will change, co-payments, deductibles. We unfortunately don't know the cost changes to A and B yet. Excuse me, that has not been released. But Medicare Part C and D, we are getting that information. And this is where you find out whether there are, benefit changes, premiums, co-payments, deductibles, formularies, plan networks. The formulary is the big thing. I'm just closing my door here for a minute. Excuse me. If you are on a Part D plan, this is the time of year I think that you need to be obviously focused. It's not all about Advantage as much because you have multiple enrollment periods throughout the year. But the formulary, the drug list is very important, and Medicare Part D is very confusing and ever evolving. However, if you do have a network-based plan, like a Medicare Advantage plan, then you should be checking your plan network and your providers to ensure that they are still in network, or if you got new providers coming, that they are in network for your plan next year. So where do you find these changes? Well, if you got a plan, you should have gotten this notice already. It's called an annual notice of change, and it comes in the mail typically in September. So by the end of September, you should have received this. If you have not, maybe sitting somewhere in your house, Of course, you could have missed it. You can call your plan and definitely inquire about this. It's really important that you do check it out. It may be confusing. We can help you understand it. But this comes for your Medicare Advantage Part C or your prescription drug Part D plans in September, and it summarizes all these changes in coverage and costs that will become effective on January 1st. I'll give you a prime example, again, personal example. I already talked about my dad, how he got me into the business because of his mistakes. My mom was then a client, and she had a prescription that was no longer going to be covered by her drug plan. That's disclosed in the annual notice of change. So that was obviously a very important signal to say we need to obviously look at other plans. So what changes can you make? And this is the big thing, right? What can you actually do during this time of year? Not that you have to, right? But if you're going to make a change, here's what you can do. If you're in Medicare Advantage, you can go to a different Medicare Advantage plan. So again, doctors change, benefits on your plan change, drug needs change, Medicare Advantage to Medicare Advantage. Understand also that if you start the year in a Medicare Advantage plan, you can also change that plan in the first quarter. So numbers 1 and 3, you can also do that in Q1. It's only a one-time change, but that is something that can happen also in the first quarter in what's called Medicare Advantage open enrollment. But for AEP, you can make those same changes. Number 2, original Medicare to Medicare Advantage. So someone that maybe doesn't have a supplement, they need some kind of financial risk aversion, right? You need to mitigate that risk because you've got no max out of pocket. Medicare Advantage plan is a good way to do it, or maybe you've wanted to change from your supplement because it's gone up to $200, $300, $400 a month, and that's no longer feasible for you, or you just want to try it out. That would be the time to do it during Medicare Advantage or during annual enrollment. And as I mentioned, number 3, that would be dropping off of Advantage and going to original Medicare. You can also do that in Q1. Very important to understand. I was talking about supplements earlier, and number 3 would be an example of where you would go from Medicare Advantage to original Medicare, and then maybe you want to pick up that supplement. Totally fine. Okay, you can definitely do that. Just understand this. The Medicare supplement annual enrollment has no impact on Medicare supplement. It's not annual enrollment period time to get a Medicare supplement guaranteed to you. You can see in here, there's nothing about Medigap. So realize that in most cases, if you didn't get that Medicare supplement when you were first on Medicare through some other guaranteed issue situation, then you will likely go through underwriting. So while you can go to original Medicare, you don't necessarily have a guarantee to go into a supplement, which is obviously a big financial risk, right? Number 4 and 4, 5, and 6 are all about Part D. As I mentioned, Medicare annual enrollment, in my opinion, is about Part D more than anything. And Part D to Part D is the biggest thing, right? You're on a drug plan now, your drug plan premium went up by 50, 60, 100%, or your drug needs change, or your drug's not covered, like in the example I gave earlier. That's when you look at making a change in number 4. You could make an initial enrollment into Part D if you didn't have it, or you can opt out entirely and just drop your Part D coverage. So here are some changes for 2024 and beyond over the next couple slides. Now, as I mentioned, we have no updates yet for Parts A and B in terms of what the new deductibles and premiums are going to be. That should come out in the next month or two. 2024 Medicare changes, a lot of stuff with Part D. So the deductible for Part D, prescription deductible is up $545. So that's the max deductible a drug plan can have. It's up from $505 last year. The Part D initial coverage limit is $5,030, up from $4,660. That's the threshold that determines when you go into the coverage gap or the donut hole. If you're wondering about this donut hole or coverage gap, why did I go into it? It's because your retail cost reached $4,660 this year, or next year $5,030. Part D troop, that's true out-of-pocket threshold, it's up to $8,000 from $7,400. That's when you get out of the coverage gap, is when your troop threshold hits the now $8,000 mark. And then Part D catastrophic coverage, which is the next phase of coverage you would go into, that 5% coinsurance you'd be paying this year in catastrophic coverage is eliminated. So that is a nice thing for those that have to go into catastrophic coverage and you're paying 5% on a $2,000 or $1,000 medication. You no longer have to pay that. The insulin savings model, which caps on formulary insulin at $35, will continue. Those of you that are insulin dependent diabetics, that change is already in place. It will continue into the new year. If you ever bought insulin on your own, you know we buy it for our dog, and it's not cheap, right? So it's great to have insurance and a cap on that. The scope of appointment, this is for compliance only. So this is something that we are really taking very seriously, because you have to make sure the person you're working with is compliant, right? So scope of appointment is a permission slip essentially that we need to have signed before we can talk to you about any of this stuff. And it has to be done starting this October, 48 hours in advance. So, and with small exceptions for timing, if you needed to talk to me about an annual plan review, we would have to wait at least 48 hours and get that scope signed. And it doesn't obligate you to anything. It simply just says, yes, you know that I have a relationship with the insurance companies, and you are agreeing for me to provide you plan information. Some other changes that are coming. So more into the following year, 2025, Part D is set to have a maximum out-of-pocket limit. That does not exist today. It never has. So a $2,000 limit on your drug costs is supposed to be coming in 2025. In theory, that is a great thing for a lot of people. Number two, first round of negotiated drug pricing to go into effect in 2026. If you are paying attention to this at all, that list was released last month. The list is actually there: Eliquis, Jardiance, Xarelto, Januvia, Farxiga, etc. Those 10 drugs are the first to be negotiated by Medicare. Medicare has never been able to negotiate drug prices before. So that starts in 2020. In 2026, that will go into effect. So, those are things to be hopeful about. Again, I don't know how that's all going to pan out and whatnot, but we'll see how it goes. And hopefully it is good for the beneficiary, which is all that we really care about. So how do we help? At this time in the year, really, primarily, it's about, hey, you got that annual notice of change. You don't understand it. We can help you understand the changes in that. Conduct a no-cost review. Again, I mentioned earlier, our services are always no cost, even if you don't work with us. I have no problem talking to somebody. A review does not take that long, 15 minutes of my time to understand whether or not you need to be in that plan or another, or at least to consider other options. And if it turns out you're in the best place, that's great. Okay. No harm done here. And I know that you may tell your friend, and again, that's how we look at this, is we're helping people out. So don't ever worry about taking up our time for a short review. But feel free to go ahead and do that. Confirm current providers are in network. If you're in a Medicare Advantage plan, that is key. Of course, prescriptions covered. Where applicable, look, if you would like plan options, we can always, of course, provide and present those to you. At the end of the day, our goal is always to ensure that your decisions for your healthcare meet your financial and your medical needs. Okay, that is the most important. Great. So I think I'll leave that up there for a minute. This is just a very short and really rather boring, admittedly, book that I put together with a colleague, and you can certainly scan that QR code if you'd like to download it. You could also email me. My contact will be up here at the end if you want a copy, or any other materials like the presentation today, or whatever we can provide you that may help your situation. So I'll leave that there for a moment. The presentation portion is done. I'll put my contact up at the end, but I think, Kayla, we can open up to questions if there are any.
Yes, we're open for questions. So I highly recommend, while we have the expert in the house, if anybody has any questions, feel free to put them in the chat or the Q&A feature, and we will wait for a few more to come through.
I will say also, I do get this question a lot, so I'm just going to address it. And it is, what is better in terms of which direction to go with Medicare? So while you guys, if you're thinking of your questions, feel free to drop it in. But while you're doing that, that question comes up all the time. What is better, Medicare Advantage or Medicare Supplement? And truth be told, and of course it's the center answer, it depends. But there's not a right answer for everybody. Medicare is a one size fits all. It really depends. I would think of things like, first of all, drug coverage. So there are definitely times where one of those options has better drug coverage than the other. But again, that depends on your drug needs, right? So if I can save you quite a bit of money going one route than the other on drugs, and then everything else meets your goals, that may steer you in that direction just naturally. Other things to think about are, what is your monthly budget? I did mention supplement route. You're paying for a supplement, paying for a drug plan, maybe dental vision. Whereas on Medicare Advantage, you're not paying for those things. So, what can you afford on a monthly basis? On the other hand, what can you afford if things go south? What's your maximum out of pocket on your Medicare Advantage plan? Is it only $3,000 or is it $10,000 or $8,000, right? So what can you afford in a worst case scenario? I do think that the supplement's a more of a peace of mind route because of the flexibility with not having to need referrals and networks, and that your supplement will pick up a lot of almost all your out-of-pocket costs. But that's if you can get a supplement, right? If you've missed the boat on that, then that becomes a very financially risky option. So it does depend. There are definitely pros and cons of both. Unfortunately, you can't combine them. But we always start that presentation with those guys on the screen because they are selling Medicare Advantage. And while some of what they're saying is true, and there are some great things about it, you have to get the full story, not just calling those numbers and letting them give you the highlights of what's the best part.
Thank you. I have one question for somebody who is just getting started in Medicare. What would you recommend, or kind of, you might have touched on this earlier, but what would you recommend are kind of the first steps in getting ready to enroll as like a new Medicare member?
Sure. So, I mean, it certainly depends on your situation, but I would definitely make sure that you're starting to get your stuff in order, if you will, research done and plans in place, at least 6 months ahead of time. So 64 and a half or 6 months ahead of retirement. Um, you can't really do a lot with Medicare enrollment, let's say Part B or A or B, until 90 days in advance. So if I'm turning 65 on April 16th next year, then my Medicare would start April 1st. I could enroll in Medicare January 1st, 3 months before the start date. So that's the timeline there. If you are not sure though which route you're going to want to go, that's where I'd spend those, 4 to 8 months ahead of time, um, you know, researching what's better for me. Is it Medicare Supplement or Medicare Advantage? That is the big decision on Medicare. Once you know you're going on it and when you're going on it, yeah, there are questions about how to do it properly, when to do it. But the big decision is how you're going to get your coverage. So that's why I would say, at least 6 months before you are intending to start would be, I would say, the shortest window. It's not that you can't do it. We can help people with a few weeks notice, but 6 months is just a good way to make sure there's no stress and you get things done correctly.
Great, thank you. We have another question come through. Memory care facilities require medications to be packaged in a particular way that only a limited number of pharmacies provide. Do plans routinely cover this, or do we need to look for plans to provide that particular coverage?
I would be looking for plans specifically for those types of pharmacies. I would say I don't want to say it's routine. I think a lot of times those types of pharmacies are covered, but it is something that should be investigated. I wouldn't just assume that, a plan does or does not. So we typically spend a little bit more time on those types of drug reviews just because it is a little bit different of a situation. Um, so yeah, I would say do your due diligence.
Okay, great. Thank you. Do we have any other questions from anybody? We could wait a minute or two to see if we had any other questions come through. But in the meantime, I do want to let everybody know that this presentation is recorded. So you will be getting a recording sent to you to refer back to if you do need it. And as you can see up here, Kevin's information is on here. So it does not look like we have any other questions coming through. So I just want to take a moment to thank you, Kevin, for your time tonight and going over all of this with us. And as I said again, everybody will be getting a recording and that will be sent to you, and it can also be found on our website. So thank you all, and we'll see you soon.
Thanks so much. Take care.